Hey guys, it's Mrs. Malott back again. We're going to finish up chapter 16 today. We're going to finish talking about blood pressure that we started yesterday and then talk about height and weight. We have 4 objectives for today. The first is to identify the normal range of blood pressure. The second is to be familiar with some vocab related to blood pressure, specifically hypertension and hypotension, as well as orthostatic hypotension. Number 3 is to describe why an accurate weight may be important. And the last but not least for the chapter is to identify how to convert pounds to kilograms and kilograms to pounds. So, yesterday we started talking about blood pressure. So we're going to finish that. Let's start by talking about what is a normal range. So first of all of the other vital signs that we talked about is when you're born, they start higher and go down. So when you're first born, like your pulse tends to be higher. Like when you're first born, it's 140 to 160-ish kind of. And then as you get older, it goes down. And when you reach adulthood, it's 60 to 100. Respirations, when babies are first born, they're 40 to 60. By the time you reach adulthood, it's 12 to 20. So there's it decreases. Blood pressure works the opposite direction. As when you're younger, your blood pressure is lower, and as you get older, it increases. But for your textbook, it kind of focuses in on adults. So the normal range for a systolic pressure is between 100 and 140 is what they say. And I would even go as far as saying that 140 is kind of high. Doctors nowadays really like that to be under 130 if we can get it there. For your diastolic, your book talks about 60 to 90. And again, 90 seems a little high, but you definitely don't want it over 90 if you can help it. When somebody has an elevated blood pressure, they have a condition called hypertension. Now, to be diagnosed with that, they have to have at least 3 different occurrences of that to happen. Sometimes people get worked up and they have an elevated blood pressure. You can't give somebody a diagnosis of high blood pressure just simply based on one blood pressure. You have to see it a couple different times before they'll diagnose it. Low blood pressure is called hypotension. And last but not least, is orthostatic hypotension. And what happens with that is your blood pressure changes. It's at its lowest when you're lying down and at your highest when you're standing up. And someone with orthostatic hypotension has too great of a drop when they stand up too quickly and their blood pressure drops, and they end up passing out sometimes or getting dizzy or seeing spots or something like that when they have that condition. So that, believe it or not, wraps it up with blood pressure. So we're going to move on. And even though height and weight aren't technically a vital sign, there are very important measurements that we need to do. They give us a lot of information very similar to vital signs. So they're included in this chapter. So when we measure someone's weight, it's giving us information about their overall health, how their nutrition is, and it's important that it's accurate because many of our medications are calculated based off their weight. So it's important that we have an accurate weight. As far as the frequency that we check it, again, kind of like vital signs, it's going to depend on where you're at or maybe what your health status is. When you're admitted to a hospital or at a facility, you're going to have your height and weight and stuff checked. When you get transferred or there's a discharge, you're going to do that at that time as well. Maybe regularly, once a month or something in between when you're a long-term care patient. The only other time that you would really do heights and weights frequently is when the person is on certain kinds of medications. There's certain kind of medications that are really weight dependent. For instance, certain kinds of diuretics or fluid pills. You might hear your grandparents talking about them. They may have to weigh themselves each day to make sure that they're not gaining too much weight or not enough, or they're maintaining it, that kind of thing. And so height and weight can be very important. So we can measure height in feet or inches or centimeters. Weight is either measured in pounds or kilograms, and depending on where you work, you may see kilograms. Definitely, though, when it comes to calculating medication doses, we are going to be using kilograms. So, in order for you to do that, if you're measuring in pounds, you need to know how to convert back and forth. So if you are measuring somebody's weight in pounds, the way that you figure out their kilograms is to divide by 2.2. So if you have someone who is 150 pounds, you take 150 divided by 2.2, and you come up with the person as weighing 68 kilograms. Now, on the reverse side, if you have their kilograms, let's say they weigh 60 kilograms, and you want to find out their pounds, what you do is you multiply by 2.2, and you find out that the person weighs 132 pounds. So that's how you convert back and forth. Now, as far as height and weights go, a couple things to keep in mind when you're doing that. First of all, the person should be weighed at the same time of day on the same scale in the same clothes, so that there's no interference with any kinds of measurements. So for instance, if you weigh somebody one day and they're in a patient gown, and the next day they're in jeans and a sweatshirt, there's going to be a big difference in their weight. So it's important that we measure them in the same clothing or same type of clothing each time, so that we have an idea whether or not the person has gained or lost weight, and we get an accurate weight. Same time of day, because as you eat, your weight changes, things like that. Same scale, just because different scales may be calibrated just a little bit differently. If you were to step on the scale that's here in the room and then walk down to the nurse's office and get weighed down there, there will probably be a little bit difference in the measurements. Maybe not, shouldn't be too much, but there could be a little bit. And when you're talking about altering someone's medication based on their weight, it's important that you use the same scale, so that you don't have a chance of that interfering with your measurement. Height, it's not done as regularly. We're not going to base medication doses or anything off of it, but it doesn't mean that it's not important. There are some medication doses specifically for kids that we might measure, but other than that, you're not going to do heights on patients as nearly as often as you're going to do their weight. And that should be about it. Believe it or not, that wraps up chapter 16. And we will review for your test tomorrow, and we'll see you then.